Hey everyone, BreeAnn Allred here, physical therapist and pelvic health specialist with Yada Yada. Have you ever wondered what your pelvic floor is and what it does? The pelvic floor has 5 functions, and if there's any issues, then we will have problems within these 5 areas of function. The first area of function is sphincteric. Sphincteric is the one we're the most familiar with when there are dysfunctions. Dysfunctions in this area will give us incontinence of either feces, gas, or urine. So this is oftentimes when we're leaking any unwanted urine or gas or feces. So the pelvic floor muscles work to provide closure of the urethra and of the rectum and anus area to allow for adequate control. Second function of the pelvic floor is supportive. Much along the lines of our sphincteric control, the supportive control of the pelvic floor helps to support the bowel, it helps to support the bladder, and it helps to support the uterus. And it provides some upward lift to these organs. Deficits in this area of function would result in pelvic organ prolapse, which is where these organs sit lower within the body or within the vagina. The third function of the pelvic floor is stability. The pelvis and the pelvic floor provide stability to our pelvis, the bony pelvis, as well as to our low back. So deficits in this area where these muscles are weak, we may have SI joint dysfunction, we may have dysfunction in our pubic symphysis or pain in the pubic symphysis area. We may also have low back pain issues. The pelvic floor functions as part of the stabilizer, as part of our deep core musculature. Now, the deep core musculature includes the pelvic floor on the bottom, the abdominals in the front, the deep low back muscles, and our diaphragm on the top. And this is very much what we refer to as our core musculature. And so the pelvic floor can be a weak link and be a contributor to back or pelvic pain. Our fourth function of the pelvic floor is sexual. The pelvic floor plays a big role in the sexual response. It helps with arousal and allowing appropriate blood flow, both for men and females. And it also provides a lot of support or a lot of awareness and allowing for appropriate sexual stimulation, as well as sexual response and orgasm. These muscles produce a repetitive contraction to allow for orgasm, so weakness in this area can promote sexual dysfunction. The fifth function of our pelvic floor is a sump pump. Now, a sump pump is something that's going to help movement of fluid throughout the body. It's a sump pump for our lymphatic system. The lymphatic system in our body is really a fluid management system and plays a role in immunity as well. So if we're having swelling in the lower extremities, if we're having swelling within the vaginal region or within the penis or testicles, this pelvic floor can actually help to pump that fluid back to the areas where it can make its way back to the kidneys to be eliminated from our body.